Health misinformation and disinformation on social media. Misinformation is information that is shared without the intent to cause harm, while disinformation involves false information created and shared with the intent to cause harm. Going forward, the term misinformation will be used to describe both mis- and disinformation. According to Statistica 2022, the number of social media users in 2022 is 4.59 billion, with a projection to reach nearly 6 billion by 2027. The ubiquitous nature of social media has created an extraordinary information ecosystem of both truth and fiction. As such, in 2013, the World Economic Forum warned that potential digital wildfires could cause the viral spread of intentionally or unintentionally misleading information. A systemic review by Suarez, Lido, and Alvarez-Galvez, 2021, found 6 categories of health misinformation on social media. These categories include vaccines, diet and eating disorders, drugs and new tobacco products, pandemic and communicable diseases, non-communicable diseases, and medical treatments and health interventions. The impact of misinformation. Misinformation contributes to reduced trust in the medical profession and public health responders. It also increases belief in false medical cures, politicizes public health countermeasures aimed at curbing transmission of the disease, and increases loss of life. Another notable impact is financial harm. For example, a report published by Johns Hopkins estimated misinformation on COVID-19 vaccines caused between 50 and 300 million worth of total harm every day since May 2021, based on the costs of hospitalization, valuation of lives lost, and long-term morbidity. Given the scope of and harm of misinformation, this presentation will recommend an evidence-based solution to the problem. According to Ho et al. 2019, it is critical for individuals to become connected with the right health information sources, such as information shared by health professionals, to obtain accurate health information that facilitates their decision-making process. According to Desai et al. 2022, establishing partnerships between infectious disease or public health professionals and pillars of the community, such as religious leaders or local officials, may be more successful in highlighting misinformation and spreading accurate health-related information to the public. Thus, the goal is to have evidence-based health information outpace unsubstantiated health information on social media. One way to achieve this goal is through the recruitment of community leaders to disseminate credible health information regularly. The stakeholders include health professionals, community leaders, and social media users. The reaction of stakeholders will vary based on social, political, and cultural norms and values. The objective would be implemented through the recruitment of healthcare professionals to provide outreach to trusted community leaders. The healthcare professionals would be tasked with building strong relationships, supplying and verifying credible information, and maintaining ongoing two-way communication between community leaders. The community leader would be tasked with providing credible health information through social media. Credible health information would be directly from the healthcare professional or researched by the leader and approved by the healthcare professional. The benefits of this approach include this dissemination of health information from trusted community leaders rather than directly from medical professionals. This is important as a 2016 Gallup report indicated that only 36% of individuals in the United States have adequate confidence in the medical system. Another benefit is outreach to high-risk communities. Across the country, people in some racial and ethnic minority groups experience higher rates of poor health and disease than their white counterparts. These populations would have a higher risk of severe illness if infected with COVID-19. Another benefit would be the increase of credible health information on social media overall. And lastly, the establishment of trusting relationships between healthcare professionals and community leaders. Thank you for viewing my presentation.